Patients come to see me for a number of reasons. The first is, by this time I believe in the community I have a reputation of giving an honest assessment of whether or not someone is or is not a good candidate for plastic surgery. Not everyone who arrives here has an operation. The second thing is I think people now know that they're going to be well treated and well cared for, not only by me, but also by a very highly professional and highly trained staff. And the third is that I'd like to think that the wisdom that comes with experience is still combined with what I would consider to be a youthful enthusiasm and a high level of interest for what I do and what my work is. During the patient's initial visit, a very detailed medical history is obtained. We then go over the reason why they're here seeing me, what they object to as far as their appearance is concerned. Then they're examined and a plan is arrived at, if they are in fact a good candidate for plastic surgery. We photograph them. We often use digital computer imaging in order to show them the anticipated outcome. We review alternatives, and then it's incumbent upon all of us, all plastic surgeons, all doctors, to discuss potential risks and complications. And finally, we review what the anticipated recovery would be, how long it would take to recover, to be able to go back to work, to go out socially, see your friends.
I've worked with Dr. Glassman and his staff for 8 years. I've been his surgical coordinator. I'm very fortunate. I feel blessed. This is more like a family to me, and we work as a great team. Everything flows, and I love it.
A plastic surgeon should have the following characteristics. First, an innate artistic sensibility. Second, manual dexterity. Third, proper and adequate training. Fourth, the ability on a day-to-day basis to shoulder the burden of responsibility of a person's care. And finally, to be of character, to be able to tell people when to have surgery and also when not to have surgery. One of the best things that's happened to me in my career is the opportunity to work on a day in and day out basis with our anesthesiologist, Dr. Alan Cohen, who, in my estimation, is without equal. Many people spend a great deal of time researching who will be their plastic surgeon, but they spend very little, if any, time thinking about who it is that's going to give them anesthesia. And that person is equally important because that person is responsible for your well-being during the surgery. And Alan Cohen is the best at what he does, and it's a real privilege for us to work with him.
The reason that I work in this office with Dr. Glassman is, first of all, it's a wonderful office. I have known about him for many, many years before I started to work for him. He has a worldwide reputation, which is fantastic. It's a privilege to be connected to somebody like that. We are one big family. We have worked together for many years. I've been here for about 15 years, and we have had the same people for many, many years, so there are no changes.
When it comes to the use of before and after pictures, I'm very much against it in plastic surgery. It's one of my pet peeves. Plastic surgeons have leather-bound books in their offices. There's the pervasive distribution of before and after pictures on the internet, and I think it's a terrible way to choose a plastic surgeon. It's only human for a plastic surgeon to show a prospective patient the very best that ever was, not the average, not the complications. And so I think it's dishonest to convince someone that you should be their surgeon based upon before and after pictures. There are many other more effective ways and more honest ways of choosing a surgeon. People are under a terrible misconception about plastic surgery, and that is they think that they can tell plastic surgery whenever they see it. And the fact is, the truth is, that they can see it when it's done poorly. But when it's done well, it passes as perfectly normal or perfectly attractive.